to all of our students. I am Dr. Umar Nazir, working as demonstrator in the Department of Community Medicine, Government Medical College, Srinagar. Today, I will be taking session on the very important trace elements zinc, fluorine, and copper. These are the subtopics of the ongoing series on nutrition. Hope you will be enlightened about the importance of these trace elements in our body. Learning objectives for this session would be to know about the importance of zinc, to know about the sources, recommended dietary allowances, functions, deficiency manifestation, toxicity of zinc. Number second, we'll also know about the importance of fluorine, which is the second trace element in this session. To know about the sources, diseases related to fluorine, and preventive and control measures related to the fluorine. And the third and last would be to know about the importance of copper and to know about the sources, recommended dietary allowances, functions, and diseases related to the copper. My dear students, let's start our session with our first trace element for this session is zinc. Zinc is an important essential trace element. Total body content of zinc is 2 grams, and out of it 60% of zinc is found in skeletal muscles and 30% in bones. The rich content or the highest content of zinc is found in prostate and hippocampus part of our brain. It's the main intracellular element. This was introductory part of the zinc. Let's move to the next slide that where we will know about the sources where from we get this zinc. Zinc is widely distributed in foodstuffs, both animal as well as plant origin. Zinc is present in meat, egg, shellfish, grain, nuts, and beans. The bioavailability of zinc is low in plant origin foods. Recommended daily allowances for zinc for adult male is 12 mg per day, 10 mg per day for females, 10 to 12 mg per day for children, 5 mg per day for infants, and there is an increased demand during pregnancy and lactation, and the recommended daily allowance for zinc is 15 to 20 milligrams. Now about the various functions of zinc in our body. Zinc acts as a coenzyme for more than 300 enzymes like carbonic anhydrate, alkaline phosphatase, RNA polymerase, alcohol dehydrogenase. Zinc also acts as antioxidant like superoxidase dismutase. It's formed of zinc. It's an important constitution that leads to scavenging of the free radicals from our body. Zinc has a role in wound healing. It also helps in insulin storage and release of insulin from pancreas. Zinc has a role in maintenance of serum vitamin A levels. It has an important role in reproduction, and it also has a role in taste sensation. These were some of the functions of very important functions of zinc. Now about the deficiency manifestations of zinc. It has been reported that growth failure occurs in children where there is a deficiency of zinc. It has also been seen there have been hypogonadism where there has been the deficiency of zinc. In adults, we have seen that there is impairment of spermatogenesis with there is a deficiency of zinc. Liver disease, myocardial infarction, thalassemias have also been reported due to the deficiency of zinc. Acrodermatitis enteropathica has also been seen due to deficiency of zinc. It's an inflammation of acral or distal parts of the body like fingers, mouth, nose and toes with the additional thing of dermatitis in them. Loss of taste acuity has been seen with the deficiency of zinc. Poor wound healing is one of the manifestations of deficiency of zinc. Alopecia has also been seen with the deficiency of zinc. It has also been reported that pregnant women who have lower zinc content in their body have neural tubule defects and intrauterine growth retardation in their children. Chronic diarrhea has also been seen with the deficiency of zinc. That's why in under 5 children we always give zinc supplementation so that it can reduce the severity as well as duration of diarrheal episodes. Now about the toxicity of zinc. It has been seen that the people who are working as welders, when they work in a heating atmosphere, they do inhale zinc oxide fumes while working on the zinc coated metals. They develop a disease known as metal fume fever. It manifests as fever, running nose, cough. So this disease is confined to these people. With this, we move to our next trace element, that's fluorine. Now about fluorine. Fluorine is another important essential trace element. Fluorine is most abundant element in nature. It's never found gaseous form because it's highly reactive. So it's always found in combined forms as fluoride. Fluorine is essential for mineralization of bones and formation of dental enamel. It prevents dental caries, probably by reducing the solubility of the enamel in the acids produced by the bacteria of our mouth. The total body content of fluorine is 2.6 grams in an adult, and 96% of the fluorine is found in bones and teeth of our body. Now about the sources of fluorine. The main sources where from we get our fluoride are drinking water and food. The other sources where from we get fluoride are black tea, black salt, sparry, tin food and fruit juices. Foods which are rich in fluoride are sea fish, tea and cheese. The recommended fluoride level in drinking water is 0.5 to 0.8 milligrams per liter. Now about the diseases related to fluorine. Fluorine is often called double-edged sword because neither it should be consumed in excess nor in deficiency. Prolonged ingestion of fluoride through drinking water containing more than 1 milligrams per liter results in dental and skeletal fluorosis, and inadequate intake results in dental caries, that's with fluoride level below 0.5 milligrams per liter of water. The onset of fluorosis is marked by non-skeletal changes which can be easily reversed by safe drinking water and nutritional intervention. If left untreated, the disease progresses into non-curable dental and crippling skeletal fluorosis. Dental fluorosis is characterized by loss of shiny appearance on teeth, appearance of sometimes chalky white patches over the teeth. Patches later become brownish or blackish in color. In severe cases, pitting occurs to give the teeth corroded appearance. It's seen commonly in incisors and molars and not seen in deciduous teeth. It becomes a permanent feature. However, dentists can modify the appearance by aesthetic dentistry. Skeletal fluorosis is characterized by the calcification of tendons and ligaments. It starts with pains in the joints of the extremities and later pain and stiffness of the back. Radiological changes include new bone formation and calcification in tendons and ligaments. Fluorosis is a public health problem in many parts of the country, especially Andhra Pradesh, Karnataka, Tamil Nadu, Kerala, Rajasthan, and Punjab. Xenovalgum, a manifestation of skeletal fluorosis, is often seen in children due to osteoporosis, as reported from Nalgondo district of Andhra Pradesh. Magnitude of problem of fluorosis in India. It's endemic in India, and the people who are at high risk of getting the disease are children, elderly people, pregnant and lactating mothers, and patients with renal and cardiovascular diseases. Now about the prevention and control measures. Dental caries can be prevented by fluoridation of water supplies. Fluorosis can be prevented by defluoridation of water by Nalgondo technique at domestic level as recommended by the National Environmental Engineering Research Institution, Nagpur. This can be carried out in a bucket with the tap 3 to 5 centimeters above the bottom of the container. 40 liters of raw water is taken in the bucket, mixed slowly with adequate amount of alum, 500 milligrams per liter, followed by lime or sodium carbonate, 30 milligrams per liter, and bleaching powder, 120 milligrams per 40 liter. Water is stirred slowly for 10 to 20 minutes and allowed to settle for nearly 1 hour. The settled sludge will be below the tape level. The supernatant water becomes less in fluorine, that's permissible limit of fluoride, and is withdrawn through the tap for consumption. The settled sludge is discarded. Reverse osmosis technique removes not only fluoride but also nitrates and sulfates from drinking water. Domestic filters are also available based on activated alumina technology. Daily requirement of fluoride, as we have already discussed, is 0.5 to 0.8 milligrams per liter of drinking water. That's 0.5 to 0.8 parts per millions. This was about fluoride, and next trace element we will be taking will be the copper. Copper is another very important trace element which is required by our body for various functions which we will discuss in next coming slides. Total body contains about 100 to 150 milligrams of copper. It's widely distributed in nature. It's present in various organs of human body. Even poor diet provides enough copper for human needs. Copper is essential for connective tissue formation, iron metabolism, myelin production, and melanin synthesis. Next, we will come across to know about the sources of where from we get the copper in next slide. We get copper from both plant as well as animal origin foods. It is present in organ meat, shellfish, green leafy vegetables, fruits, nuts, and cereals. The recommended daily allowances for copper is 2 to 3 milligrams in human adult, and in infants it remains 0.5 to 2 milligrams per day. Now about the functions of copper. It's a cofactor for various enzymes in our body: cytochrome oxidase, catalase, ceruloplasm, ALA synthetase, tyrosinase, superoxidase dismutase. It's also involved in cellular respiration through electron transport chain. Ceruloplasmin helps incorporation of iron into transferrin. It also works as antioxidant in our body. It has an important role in melanin synthesis also, and it's a role in vessel wall. Now about the diseases related to the copper. First one is the Wilson's disease. It's an autosomal recessive disease. Another name for this disease is hepatolenticular degeneration. It is due to the mutation in copper binding ATPase. This is required for the transport of copper from liver to the bile. It leads to the accumulation of copper in liver due to the blockage. Another manifestation of Wilson's disease is Kayser-Fleischer ring, which occurs in the cornea of the eyes. It's a brownish discoloration or golden brownish ring in the cornea in the descendant membrane of the cornea. Second manifestation of copper-related disease is anemia. It is hypochromic microcytic anemia. Third one is the CVS abnormalities. It occurs due to the defect of lysine oxidase. The vessel wall becomes fragile, that leads to aneurysm or rupture of aorta. Fourth one is our hypopigmentation. It occurs due to the deficit of tyrosinase, which contains copper. And the last one is Menkes Kinky hair syndrome. It's a rare X-linked disease affecting male who present at 2 to 3 months of age due to abnormal functioning of copper-dependent enzymes due to deficiency of copper. So this was all related to the copper, and hopefully we will meet in the next session on the trace elements. Thank you.